Hey, what up with you guys? Thank you for finding me on YouTube. I'm Mabu Nakagawa. Let's go dive into today's episode of Mabu channel. I haven't talked about this for a long time because I'm not responsible for what I say about this topic. I have to be so picky when I talk about the coronavirus infection and its related information on it. Most recently in Japan, people still keep saying Omicron, 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 and Omicron every time I go out. Every single TV program repeats Omicron Variant. It's so critical. We gotta keep social distancing. Omicron became a vast majority of new COVID-19 cases in Japan. I think that's true, but what we concern about the Omicron is that we don't yet know how easily it spreads or how well available vaccines and medications work against it. The Omicron variant is still spreading more easily than the original SARS virus, and it still remains unknown. Generally speaking, coronavirus was said to be originated in China and spread abroad in no times, like worldwide within a few months. The former President Donald Trump used to call it Chinese virus, but the dynamic increase in COVID-19 cases is still a big concern of our lives as of now. Since the virus outbreak 2 years ago, it's still been a global issue with the infection. Over the past decades, we've had 4 prototypes of coronavirus classified as SARS, MERS, SARS-CoV-2, and I forgot one more. But anyway, everything we need to know about the coronavirus is that it's incredibly contagious. Now that we got up-to-date information on the vaccination process, we can ensure how to get vaccinated soon and safety. I never say we should underestimate Omicron's severity. We still need to stay in alert to have face-to-face talk with strangers and get close to each other, especially in public. That's a prerequisite social manner before you interact with people randomly, right? Yesterday morning in my hometown, it was so snowing out there that I had to go to my company by public transit instead of driving because it seemed to be dangerous to slip tire, so I wanted to avoid my car accident. I was on a platform waiting for an upcoming train in a line, and when I get in a train, so many people are so packed in a contaminated space. I felt so filthy because I stand next to the other passengers who might have been so infectious, you know. Unconsciously, I became a clean freak. But anyway, I mean, it cringes me when I see people with mask, but with mask showing their nose. You know, that's not good. I don't like. On the top of that, what surprised me the more when I went to take a hot spring with my friend was that I and my friend Kimura-san were in a small sauna room, but there were so many masculine men occupied in the whole room. Those guys were so energetic that I didn't want to sit down next to them, so I pinched my nose and covered with mouth with my palm and stayed patient for like 5 minutes. Then I got so dizzy when I came out and I was like, oh man, I'm so I'm sorry, excuse my language, but my friend Kimura-san was okay. He was normal. I took a cold bath right away and cooled my head. Then I felt so much better. We had 3 consecutive holidays over weekends in Japan, but I stayed indoor after the incident because I didn't want to go back to be scrambled with a group of people outside of my house. That's why I'm always recording my video in my personal studio every time right here. Preliminary data from Europe shows a significantly reduced vaccine effectiveness against symptomatic disease with Omicron as compared to Delta, which further rapidly declines a few months after dose 2. So, vaccination is, so to speak, quite effective, particularly for the protection against severe COVID-19 related disease. Based on the current situation and available evidence, however, Japanese government still wants to declare the state of emergency in Okinawa again in case of something really bad happens, because overall level of risk is still increasing. In the upcoming week, the very high growth percentage of Omicron is expected to result in higher overcome cases, and then such a high level of Omicron transmission might as well to lead to a high level of absence from work, including among healthcare and other essential workers. Obviously, that's the worst scenario. But as far as I see how our life is going on in public, it doesn't look like people really pays attention to the government. That's sad, but unfortunately, that's true. I guess most of you guys in your country have the similar type of idea against transmission prevention protocol published by the government, because it sucks. People don't really follow it. In Tokyo, it seems people are hanging out with their friend Shibuya, Harajuku, and Ikebukuro overnight. They repeat the same mistake, In order to reduce ongoing transmission, we gotta follow infection prevention guideline published by healthcare organization, so to speak. I saw a bunch of another stupid folks fooling around at the local station in Yokosuga on coming of age day. I'm so tired of watching them in breaking news this time, but see every year young idiots come out, make noise, and get arrested even under pandemic breakthrough. I mean, they would have been considered officially as an adult at the age of 20, but nonetheless, they are still childish. Dude, I've been telling you so many fucking times. Last time the ceremony was alright because the ceremony was cancelled for the sake of lockdown. This time I knew this was gonna be happen. Okinawa has a lot of problematic younger people too. As young folks get aged, they come to realize that finally it would have been a big mistake, but it's too late to regret. In Japan, traditionally we repeat the same negative routine every year, especially on coming of age day or sort of annual events such as the summer firework festival and New Year. They get naked and go hustle, crazy and whatever, like they jerk off in public. It turns out a chaos that is completely uncontrollable. Come on, I'm telling you this so many times because it's important to notice. I think it's as impossible as eliminate these helpless idiots as to eliminate the Omicron variant. So if my perspective is right, what do you think we should do? The answer is so simple. You know what it is? Nothing. No way, man. Hell no. Japan government declares a state of emergency more than 3 times last year, I think. All stores were closed. The store owners filed bankruptcy finally. Economy rapidly went down. Stock market was so messed up. Everything didn't go well. People exploit their emotions so badly. They want to complain, but they don't know to whom. That's why they get so crazy. The government needs to do something like they prohibit selling alcohol. They force stores to close before 7 p.m. and then they do whatever meaningless, but they are all strike out. No one takes full responsibility for strike out. They just keep a straight face and pretend to be sober. What the f***? You wanna say that, right? You know why Japanese politicians are willing to do such counterproductive politics? Because they want to win the election. They want to show you and prove you how well it works in number. They raised an outrageous propaganda like putting you on a very strict lockdown and making you stay home and watch Olympic Games on TV. They don't know scientifically it makes sense to you, but you are haunted by media control. Your brain is like manipulated. The quick vaccination delivery was actually a good outcome. They provided you with enough vaccines to get shot twice by the end of the last year. You felt so much better then. You got so pumped that they could be so proud of the result. They want to say, well done. Shit. They want to say well done with that. That's how they earned trust from the people living in Japan. Japan government took the highest priority to deliver enough vaccines at the time for over 100 million people at the earliest. So in terms of vaccination, it worked. However, on the other hand, for those who are running the food business in a restaurant industry, it was so terrible because they got a huge business impact on sales during the Tokyo Olympic in 2021. The Olympic Games were held with no spectators in empty stadium. That meant people didn't buy ticket, utilize public transit, buy food, goods, service, entertainment, or whatever related to the Olympic Games. Everything turns junk. That's the last straw for business people, right? Japan prioritized our life insurance rather than business infrastructures, which was good policy. That's why a severe lockdown ordering residents not to leave home looked so successful. But I think it's almost time to relax the restrictions gradually, There was another big problem with Omicron variant. Let me tell you what it is. When the medical workers tested positive with Omicron variant, they have to stop working immediately. Even individuals who were diagnosed as a more mild disease are not allowed to come back to work right away. They don't really feel sick, but they were asked to take a PCR test. PCR test is so sensitive to detect coronavirus though. Even if you are infected by just a little bit of coronavirus within your body, you are likely to test positive. When you examine sort of a rapid diagnostic test to detect if you are sick of flu, most of the time you are negative, but PCR test is way too sensitive. What happened is that we're gonna be having a medical expert shortage. I mean, a lack of workforce from doctor, nurse, to people working at the pharmacy. This can cause collapse of the medical system, so to speak. That's my conclusions. We all are already aware coronavirus is unstoppable, folks. Especially Beijing is now on high alert for the new outbreak as it prepares to host the Winter Olympic Games next month, sticking to zero COVID strategy of targeted lockdown, border restrictions, and severe quarantines. It works, but to be honest, it's impossible to control restrictions nationwide. As compared to overseas countries like China, Japan has a relatively only low percent of death ratio. So I guess it's time to make a further movement rather than stick to vaccination. Likewise, excessive prevention against the Omicron variant should be counterproductive. I believe you can agree with me. Alright, thanks for watching. That's all. I want to share the current situation as for coronavirus in Japan. Again, thank you so much. That's all. I'll see you another episode of Mabu channel. Have a great weekend. See you. Bye.